All right. Hello, everyone. Welcome. My name is Logan Dean, and I'm the Vice Chair of Programmatic Affairs for the National MAPS Committee. Tonight, we will be talking about insight on international medical schools with our speakers today. This webinar was created by the National MAPS Committee and the International Affairs co-chairs in order to provide support for our current pre-medical applicants. Um, excuse me. The application process is hard enough without the addition of the ongoing effects of the pandemic and economic spirals. So, we are here to hear from those who have done it before us and answer your questions. We're looking forward to hearing from you all's questions in the chat. So, please, throughout the webinar, feel free to ask your questions in the chat. At this time, I would now like to ask our panelists who are joining us for this exciting session tonight to introduce themselves and give about a 1 or 2 brief introduction about your journey.
I guess I'll start since I'm already unmuted. Hi, everyone. My name is Milena Garcia, and I represent both Ross University School of Medicine as well as American University of the Caribbean. I'm here representing the admissions department, and we have 3 panelists with us here today. So I'll kick it over to future Dr. Acuna.
Hello, good evening, everyone. My name is Akona Lonu. I'm currently attending Ross right now. I went to undergraduate school, or attended my undergraduate university was UT at San Antonio. Again, like I said, I attended Ross, and I'm applying this year for MedPeds. I guess I can go and popcorn to BIMS.
Hello, everybody. Good evening. My name is Chidu Bem. I also went to Ross as well. I finished my rotations July of last year, and I'm in the cycle right now for internal medicine. So we'll see how match day looks, and I look forward to talking to the rest of you. Thank you for having me.
So my name is Brianna Barber. I currently go to American University of the Caribbean. My undergrad, I went to Ohio Dominican in Columbus, Ohio. I'm currently in preparation to take step 1, and I plan on being a neurosurgeon. Sorry.
Thank you so much, everyone, for your introductions. Milena has a presentation for us, so we will begin with that presentation now. Thank you so much.
Thank you, Logan. All right, so I'll go ahead and get started. First of all, please feel free to use the QR code here in the link. I did post the link in the private chat. I'm not able to if somebody can copy and paste the QR code, the link to the same link that I have here onto the chat while I'm talking, that would be great. Please, I appreciate it. This is how we keep track who attends our meetings. And if you'd like to stay in touch with us, if you have additional questions, if you'd like to hear more about our other events, we often do live chats with current students and alumni. So I think it's a really good experience for you here today with the 3 panelists. So if somebody could copy and paste the link onto the chat, that would be great. Again, as you just learned, my name is Milena Garcia, and I represent both Ross University School of Medicine as well as American University of the Caribbean. I'm the National Associate Director representing the Access and Inclusion in Medicine, also known as AIM Scholars Program. And co-presenting with me here today are the 3 panelists that you just heard from. We will have a moment to have them tell a little bit more of their stories and then, of course, answer questions. So the entire second half of the meeting will be our 3 guest stars here. I will just take the next 15 minutes to do an introduction of the 2 programs so you know at least what to expect and when in more or less what to ask them. Once you already know what the schools are, you can ask our panelists here about their personal experience. So first of all, reason why, and I know your series here is called Insight on International Medical School series, right? Why is there the need for international schools? Basically, because there's not enough seats in the US. The US medical school has admissions process has become a numbers game, right? As you can see here, and this data is pulled from the AAMC for the past 10 years. The average GPA for the accepted students was around a 3.67. The average MCAT for the accepted students for the US schools has been around a 512. Last year alone, there were over 62,000 applicants for 22,000 spots available in the US. So you can clearly see more than 3 times more the amount of applicants for the amount of spots available. And that was unfortunately a 36% acceptance rate, right, for the US. Now there's 64% of the students, prospective students, pre-med students that are still interested and would like to become a doctor. What happened to them, right? There's just simply not enough seats, physical seats available. So the reason why international schools exist is to help more students so you don't have to give up your dream. Listen, I am not here to talk you out of your in-state school. Okay, if that's your first choice, you go for it. You apply to all 20 different schools that you want to. I am here to tell you not to give up. My message here is to know about other alternatives, know about what's also available to you that can get you successfully to your goal of becoming a physician. And I say successfully because, yes, there are so many international schools. How do you narrow it down, right? So I'm going to show you a couple of different criteria that at the pre-med level you can use to help yourself narrow down the schools that you should be considering. Right. So, first of all, residency match, right? If you plan to practice medicine in the US, then you have to go MD. Okay, MD programs, you have to go through the same residency match program as everyone else. So if you look at the residency match list, that will tell you how the schools are placing their students. In fact, let me open a quick parentheses. It's a fair question to ask about the residency placement, but know that the medical schools don't place you into residencies. Okay, you know, one of our panelists is going through his residency match right now, so we can ask him about that experience. Know that it's not the medical school placing, it's not a passive placement, right? It's you once again filling out an application, showing up for another interview, convincing that committee that you're the best candidate for that job. That's what it is. It's your first job out of medical school. So by looking at the residency match list for each school, that will tell you how the schools are preparing their graduates. Okay, so number one, look at the residency match list. Number two, look at the USMLE pass rates. USMLE stands for US Medical Licensure Exams. If you plan to practice medicine in the US, you have to sit for the USMLEs. Okay, so again, like the MCAT, right? So this is the same exam no matter where you go to school. You're sitting for the same USMLEs and you're applying for the same residency programs. Okay, so I just gave you two main criteria that when you're looking at it, that will tell you how the schools are preparing their students. Now, I gave you the tools. Now, let me give you our numbers so you know where Ross and AUC stand when compared to everyone else. Ooh, before I go on, let me just quickly show you our timeline so you have a visual perspective of our programs. Both of our programs are MD programs. Yes, we're an international school, but we actually mirror the US MD program. So our curriculums are designed very equivalent to the US programs. The difference being that the medical sciences, the 2 first years of medical school, is actually done outside of the US. AUC is in St. Martin. Ross is in Barbados. Actually, because we're on a trimester system, the first 2 years of medical school is actually not 2 years. It's a little bit shorter. So you're there for 20 months. Okay. So again, the clinicals part of the program we call medical sciences, which would be equivalent to the first 2 years of medical school here in the US, are only 20 months for us. In the Caribbean, in St. Martin for AUC, in Barbados for Ross. Then you're back in the US for all the clinical training. All your clinical rotations will be here in the US. You're physically back here. This is the time that you sit for the USMLEs step 1 and 2. Okay, you're done with your medical degree. This is when you go on to apply and do your residency. Okay, so this is the timeline. I like this graph. I think it gives you a really good visual perspective of what to expect. So 20 months out of the country, you're back in the US for the clinical training. So now that you're into residency, let me give you our residency match in USMLE pass rates. Ross and AUC are sister schools. We still operate separately. I'm the common denominator. Okay. I speak for both, but they still operate separately. So you're still applying to 2 separate schools. They're 2 separate admissions departments. They're 2 separate admissions committees, right? So you actually just doubled your chances of getting into medical school. Apply to both. We are waiving application fees. We do feel that not being able to afford the application fee should not stop you from being able to pursue your dream to become a doctor. Okay, you should not become a doctor because you don't have the $100 for the application fee. So we are waiving application fee for the schools. For AUC, last year we had 280 graduates go into US and Canadian residencies. That was a 96% match rate for our AUC graduates. That's 2022. And this residency match list is posted online. You can see 15 years posted online. You can clearly see, you can filter by specialty. You can look at it by hospital alphabetical order. You can filter by state. Okay, so all our residency match lists you can see at any time on our website. Now, Ross is a little bit bigger classes. So last year at Ross, we had 458 graduates go into US and Canadian residencies. That was also a 96% match rate. Please know we don't have a class of 500 students. Remember, I briefly mentioned we're on a trimester system, which truly means we start 3 new classes every year, which means we end 3 classes every year. However, residency only happens once a year. So this is all 3 classes going in together. Okay. So this is the total of 3 classes, everyone going through the match that same year, 2022. And that was a total of 458 for a 96% match rate for Ross. Now, the 2 schools are very comparable as far as curriculum. We follow an Oregon system-based curriculum. You can ask our panel here today to talk a little bit more about how the program was and is for them. There's a lot of technology on both of the campuses. We use the Sectra dissection tables. We have the Complete Anatomy app already available to you. At Ross, you actually get an iPad before you even get there with all your ebooks and the Complete Anatomy app already uploaded there. We start hands-on very early with you're doing live palpations, you're conducting ultrasounds, you are already working with the high fidelity patient simulators as early as first semester. Okay, so very integrated classes, very hands-on. We want to make sure that your the clinical training is already introduced as early as the preclinical, because it's important that by the time you get to your clinical training, your clinical skills are already honed. The clinical rotations, those are not Ross and AUC sites. Those are US teaching hospitals, right? You will be working under U.S. attendings. Those are also the doctors who are going to be writing your recommendation letters for residency, right? So it's important at that level to be impressing these attendings so they can write you a recommendation letter. And how are we going to do that? By teaching you the hands-on, the clinical skills before you get to your clinical training, right? Of course, we can't anticipate everything, but we do try to already incorporate as much of the clinical training as early as the preclinical. Pictures of the campus. Both of our schools were established back in 1978. The top picture here is Ross University in Barbados. The bottom picture here is AUC in St. Martin. Once you arrive on campus, we will pick you up at the airport and take you to your housing. So housing will be set and already done before you arrive. Coverly Village is the housing in Barbados. It's about a 15-minute drive from campus. We do run shuttles. You don't have to get a car. The bottom picture here is the AUC on-campus housing. We do have the new student coordinators that will help you transition. You're not doing this alone. Okay, we do have the representatives who will assist you with the transition. And again, please remember to ask our panelists about their transition as well and how they felt it went. We work at the campus like a normal campus, so you can expect all sorts of student activities, lots of campus organizations, either interest related, like the surgery interest club, the primary care club, the oncology club, or cultural/religion, or sports related, right? So lots of clubs. Of course, medical school, you're very busy. I would say at first, maybe only get involved with one club in addition to going to school, and then assess your time, see if you can handle more, maybe take on leadership positions as well. You can be a tutor on campus. We do pay the tutors, a peer mentor, an ambassador. There are other positions, leadership positions that you can take up on campus. Research also. Okay, so definitely get involved while you're on campus. Once you're done on campus, you're in the U.S. for the clinical training. As I mentioned, all the clinical training is completed here in the U.S. Here are all the affiliated teaching hospitals. You can see some of them are Ross specific, some of them are AUC specific, some of them are both. Right? You can find this list also at any time on our website. Remember, the two schools operate separately, so you need to look at the Ross site and you need to look at the AUC sites separately for their specific hospital affiliations. I know I'm speaking very quickly. It's because I really just want to do a quick introduction of the programs and give our panel more time to speak about their personal experience. Two last points that I wanted to make is, as I mentioned, we are on a trimester system, which means we really do start 3 new classes every year: January, May, and September. Unlike U.S. medical schools that only start once a year, we have a new class starting every 4 months, right? This is a way that we have to be able to give more opportunities for students. And this is why we're able to graduate more doctors as well. Not just because we have the bigger classes, because we start a new class. We're a private school. Our professors are there year round. So we're able to get the professors teach the class 3 times a year. Okay. And because we're on rolling admissions, you can apply to our programs at any time. I suggest that you apply 6, 8, 10 months ahead of time because we are on rolling admissions. There are no deadlines. However, please keep in mind the admissions process takes about a month and a half, 2 months for the whole thing to process, for us to process the applications, bring you in for the interview, send you the application to the admissions committee. Okay, that whole process can take a month and a half to 2 months. We approve as we go. So the day we get your application is the day that we start processing it. The more time you give yourself, so the earlier you apply, the earlier you get your answer. Again, unlike U.S. medical schools, it's not like, oh, deadline to apply. oh, interviews at this time, oh, release decisions this time. No, we are fluid. Okay, it happens at all times. The timeline is for you only. The day we get your application, we start processing. In about a month and a half after that, you have your final decision, which means the earlier you apply, the earlier you get your answer, the more time you have to prepare. Best case scenario, you're moving to another country, right? So that gives us and you more time to do this transition slowly. If you apply 2 months before school starts, in a month and a half, we give you your answer, and now you're down to 2 weeks to move. Okay, it's doable, but we don't want to stress you out. Listen, medical school will stress you out as enough as it is. We want to make sure that you are arriving already refreshed, right? So the more time you give yourself on the transition, the better it is. So 6, 8, 10 months ahead of time, that's when you should be submitting your application. With that being said, if there's anybody on the call right now that is sitting out for your gap year, and please know that the May class is still open. We are expediting applications for the May class. Please email me separately from here. You have my contact information. I will expedite your application. I will put you in touch with the admissions department, and we will move this quicker. Okay. Anybody who would like to be considered for May class, the May class starts the very first week of May, which means accepted students will have to be there the last week of April. If this timeline works for you, please get a hold of me as soon as we're done here so we can expedite your application. I am also available for unofficial transcript evaluations. This is something that I can voluntarily do for you. Contact me off the record, under the table. You're not applying. We can talk off record and do unofficial evaluations. I can tell you what I see from the admissions perspective. We'll schedule 15-20 minutes call. Okay. And please, so stay in touch with me. I'm happy to do that for you. You can see here the websites. Like I said, you can apply directly on our websites, and it is free to apply. And lastly is financial aid. Of course, we know that medical school is not cheap. It's an expensive endeavor, right? We can help you plan for this. I can do an entire workshop on how to finance your education. So please get a hold of me as well if you're interested in hearing more about that. For the sake of this meeting here, please know, even though we're an international school, we are recognized by the U.S. Department of Education, which means our students are eligible for the FAFSA loans. You may already be familiar with the FAFSA. You may have already done the FAFSA. It's the same process for us. This is a really nice compliment. This is the U.S. Department of Education validating our programs and willing to work with our students the same way. We also have several scholarships available. I strongly encourage you to look on the Ross site, on the AUC site specifically. Both sites have 10 to 15 scholarships listed. Some of them are academically based. Some of them are merit based. Some of them are need based. Some of them would be research based or community outreach programs based. Okay, many criteria listed there. Please take a look. There, the details, how much, deadlines, eligibility, all the details are listed there. Some of them have deadlines, so definitely do your legwork. Free money, right? Scholarships are money that you do not have to pay back, so definitely worth doing the legwork on that. In case of doubt, any questions, please feel free to contact me. Okay, I am here to assist you. That is all I wanted to cover, a brief introduction of our programs. Now you know who I am. I would like to quickly reintroduce our panel and open for monitoring with the questions. So let's start again. If our panel could one by one reintroduce yourselves. Future Dr. Brianna, we'll start with you. If you could take us through your timeline, maybe where you came from, your undergrad institution, where you are today, and how it's going.
Okay, so once again, my name is Brianna Barber. I went to undergraduate at Ohio Dominican in Columbus, Ohio. I'm currently a fifth semester at AUC, so I'm wrapping up, getting ready to take my comp. I'm also preparing for step one. Um, I can for sure say that the road here was not expected. So just because when I was in undergrad, I didn't know that I was supposed to take my MCAT my junior year. So my senior year came around and I was gonna have to take a little over a year gap year. And I know myself and I was like, okay, the longer I'm out of school, I'm just not gonna do it. So I looked into the Caribbean schools and they were all year round. So I just applied and I got in. And I can honestly say I don't regret it because I met a lot of good people along the way. And I feel as if my institution, I can't speak for Ross, but AUC, they're building their curriculum more towards treating people as people instead of treating the patients as numbers. So I like it.
Thank you. I appreciate it. Let's go to future Dr. Ilono. Please reintroduce yourself. Tell us again where you came from, your undergrad institution, and where you are today.
Okay, hello, my name is Akona Ilanu. My undergrad institution was UT San Antonio, so University of Texas at San Antonio. Currently attending Ross University, expected to graduate this year, this upcoming 2023, so yay me. I'm currently applying this match cycle for MedPeds, which is a combination of internal medicine and pediatrics.
Okay, thank you very much. And Doctor, is it pronounced Neyamu?
Yes, it's Noewo.
Nuevo. Okay.
Yes. Hello, everybody, again. My name is Chidubem Noewo. I actually went to University of Maryland, College Park for my undergraduate career. And then, let me say, I wasn't the most dedicated undergrad student, let me put it like that. So my GPA, I didn't believe was as competitive enough to get into US medical schools. So one of my friends told me about Caribbean medical schools, and I did some research on it, and funny enough, I only applied to two schools, Ross and SGU. And then, I just knew that I have what it takes to thrive. I just needed an opportunity, and Ross, they gave me that opportunity, and I'll forever be grateful. Right now I've completed all rotations, step 1 and step 2, I'm in the match cycle for internal medicine, we'll be finding out soon what's going on, and then graduation is in May. So
thank you. First of all, I want to thank all three of you for being here today, and for making this decision. You guys are the living proof of what I stand for, right? Why do I do my job is to make sure that I see you succeeding. For everyone else on the call, you know who the panel is now. I can represent admissions. We have a current student at AUC. We have a current student at Ross who is preparing for her steps. And we have a recent grad who already took his steps and is going through match as well. So please, let's open the floor for questions. And Logan, I don't know if we can, I guess we can use the chat, or I'm not sure if people can unmute themselves. How would you like this?
Yeah, so the platform we're using, we can grab questions from the chat, but they actually won't be able to unmute themselves, so I can read from the chat as they come in. But I do have some prepared questions.
Great. Let's start with those. In the meantime, while we're doing the prepared questions, guys, please start posting your questions so Logan can read them later, okay? Go for it.
So the first question is actually for you. And before we begin, the further discussion about specifically Ross and AU, I wanted to ask what classifies a school as international medical school, because the AMSAR that we have access to, there are some Caribbean and Canadian schools on that database. And so that was a little bit confusing for me as a pre-med, looking at AMSAR and saying, okay, well, if it's on AAMC's website, does that mean that it's a US-based school? Like, what does that mean in terms of when we're researching schools?
So my understanding, and again, this I'm not familiar with MSAR, and I don't represent AAMC, so I'm not familiar with every detail that's on their website. My suggestion to you is international medical school is one that is not physically located in the US, right? In our case, part of our program is in the Caribbean, part of our program is in the US. But because we follow an equivalent curriculum to the US, we are approved to practice in all 50 states. So when you're doing your research, if you find a school that that you're interested in, go on their site, look at their physical address, read all this, what the students have to say, read the testimonial, find where their main building is. If they're outside of the US, then they are considered an international school. At that point, you need to find out if that school is allowed to practice, approved to practice in all 50 states. Okay. In all 50 states, as well as the 10 provinces in Canada, is very important because there are some international schools that, based on their accreditation, are not approved to practice in all 50 states. And you may think, well, I live in Tennessee. Why do I care what California decides, right? As a matter of fact, California, New York, New Jersey, Texas, and Florida are the biggest states and the ones that actually do spend the time and the money to decide their own to make their decision if they're going to allow an international school to practice in their states, right? So they take their time, they research the school, and they say, okay, we allow certain schools and not the others. The rest of the states basically say, I will go with whatever California decides, right? So yes, you could be all the way in Tennessee and they're following somebody else's decision. Okay, so when you're looking at the schools that you just found out is now considered the international school, call them and say, number one, will your students, are your graduates approved to practice in all 50 states? Not will they be in the future, are they now? Nobody can promise you the future, right? Are they now? Are they allowed to practice in all 50 states? Yes. Okay. Second question you should be asking, is your school recognized for the FAFSA? Not just financial aid, because financial aid can mean a lot of things, right? Those two questions alone will narrow it down to the schools that are mostly recognized, have history here, right? I strongly suggest, if you happen to come across an international school, ask those two questions to help narrow it down.
Thank you so much. That was information I wasn't aware of, and hopefully that was beneficial to our audience as well. We do have a question that came in the chat for our medical students and our graduated medical student from Gabrielle Pearl. She's saying, hello, everyone. How many times did each of you apply to medical school before you were accepted? And did any of you take the MCAT? And if so, how many times did you take the MCAT? And we can start with Akuna.
Okay, hi Gabrielle. So in terms of applying to medical school, I did apply twice, and I did take the MCAT as well. And just for clarification, because I actually didn't mention it, I'm currently doing clinical rotation, so I'm a fourth year medical student. I have taken step 1 and step 2. And again, like I said before, I'm applying for the match this season because I will be graduating this year as well. So that's that. But as I mentioned before, I applied twice and I did take the MCAT.
Yeah, definitely. You whatever medical school you go to, you still need to take the MCAT. It's still like a prerequisite for everybody, to the best of my knowledge. I took it as well, and I applied one cycle. Like I said, just to Ross and SGU, and luckily I was accepted to Ross and SGU. But SGU, I think there's this program called MERP. We can get into that later on. SGU offered that route, but Ross allowed me to start without going through MERP. So that's one of the things that allowed me to opt to go to Ross University instead.
So I took the MCAT once. I did one rotation cycle, like to apply to all the medical schools, but my situation is different because I finished in December of 2020. And when I started to get accepted into the schools in the States, the enrollment would have been for fall of 2022. And I didn't want to wait that long, so I just went the Caribbean route. And if I would have went the state route, I would have been so far behind in what I am now. So
Thank you all. Gabrielle has a follow-up question stating, did any of you qualify for scholarships? Also, did either of the schools offer scholarships specifically for military students? So I'm not sure if anybody, I don't
I
think that was
think I
anybody.
can answer that before they answer. Since we are in international programs, we're not eligible for the military scholarship. The U.S. military doesn't pay for international schools. Which makes sense. Okay, the one way to go around that, if you anybody here interested in armed forces, what you can do is go through medical school and through with the loans. Then when you get to residency, the armed forces have a loan repayment program. So I encourage you, reach out to their recruiters so you can talk more about it. But if you ask about the scholarship, the answer will be no, because we're an international school. Ask them about the loan repayment option. So that's it for as far as military scholarships for us. I'll kick it over. Anybody scholarships?
I actually did receive a scholarship going into Ross, but at the time, the scholarships were a little bit more limited. So you could only get it your first semester coming in. And if you did get one your first semester, it might just be that one that you had, or it was from the first semester you would get that scholarship and it would continue throughout your 4 or 5 semesters that you were on the island. But I think they've kind of changed the options now for scholarships. So you might have more opportunities to get a different scholarship or have various like opportunities with that scholarship if it makes sense. So one of my roommates at the time, she did come in with a scholarship, and it also included like tuition as well as living expenses. So I would look into kind of the site and see what they have to offer, but you do have opportunities to receive scholarships.
Akuna, do you recall where you applied for that scholarship? Did you apply for that after you were accepted or as a pre-medical?
I applied for it after I was accepted. So there's some scholarships that you can automatically get. There's scholarships that you can apply for, at least when I started. So there was some that you can automatically get based off like grades, GPA, and I believe the MCAT score as well.
Mhm.
And then there's some that you will apply for. There was an alumni scholarship that you would apply for, but you needed a alumni of the program. So I had someone that I knew from Ross that could write a letter for me and submit that scholarship. But in regards to the new scholarships, again, I'm not too familiar with it, but there are different options.
I just posted the links on the private chat. I'm sorry, I'm not able to add to the comments. Yes, Candida, please share so I'm sending you guys the scholarship links for the 2 schools right now. Thank you.
Did any of our other panelists receive any scholarships while you attended your universities?
yeah,
Yeah.
so mine was the GPA based as well as the MCAT based. So at least at AUC, they had 2 different ones that you could get. If you had like a GPA of like 3.0, or I forget what number it was for your MCAT, they would give you a tuition scholarship for your 5 semesters or your 20 months on the island. But when you do your rotations, you won't have that. And then they have a higher one if you had a 3.6 GPA or a MCAT of 510 or above. You'll have the financial scholarship throughout all of your years until you graduate. So I was able to get that one. But I think there are other ones that you could apply for. but I was just given that one upon admission.
Yeah, honestly, with the credentials that I had coming in, applying for a merit-based scholarship wasn't necessarily on the table, on the cards. But that being said, I didn't apply for any. Yeah, but I do know like other students, including Akuna, that received scholarships as well.
Okay, thank you all for sharing your experiences. I kind of want to talk more about like immersion into your respective schools. So we kind of already talked or did an overview of the curriculum and things of that nature. I kind of want to know more about how you found yourself adapting to your new environments and balancing that with adapting to the rigor of medical school. And we can start with Brianna.
So I would definitely say go and try to make friends because medical school is hard on its own, but it's better if you have people that are around you doing the same thing because then you guys can push each other and study with each other. I'm very big on study groups because the material that you would learn in one semester in college is the material that you would learn in 1 week of medical school. So it's just impossible for you to go through all of that by yourself because you don't know what you don't know. So I may think that I'm doing super good, and then I go and do questions with my friend David, and he's like, "Oh, hold on, I didn't know about that." And I'm like, "Oh, hold on, I didn't know about that." And so we're figuring it out before the exam, but it's good to just have people around you, especially because you can complain to each other. They understand where you're coming from, but they can also help lift you back up and make sure you're still on track.
Yeah, I definitely echo Brianna's comments. The transition a little bit from my background. I did boarding school in Nigeria, so I have been away from family previously. So this wasn't necessarily a completely a different thing. But that being said, being in a novel environment and having like the rigors of like, medical school, nothing like I've ever seen, in the past as far as like the volume of information that you need to digest in order to move forward. Definitely it does help to have like a group of people that, you'll be able to talk to, when needed, when necessary, and rely on, when the time comes as well. And as long as you're vocal about your needs, I feel like Ross, there were a lot of like resources that were available to us, in our times of need. In addition to having like your own people, just having like the faculty as well. I could definitely like talk to my professors, email them, show up at their offices for office hours, and then yeah. So I think it's definitely doable as long as you set your mind to it.
I completely agree with both Brianna and Chidubem. I would say, in addition to like friends and resources, it is difficult adjusting to a new environment, especially if you're not familiar with it or you yourself haven't been away from friends or family for a while. And I think, again, like Brianna was saying, it does help to have friends, especially with adjusting to the environment, but also like the rigorous life of being in med school. Another thing I would say is enjoy it too, because yes, you're in medical school. Yes, it's going to be tough, but you're also on a beautiful island. For me, it was Barbados. The beaches aren't like across the street, but you're on an island, so they're everywhere. I would say enjoy the environment. Go to the beach if you can or if you want, but also enjoy the culture. Like it's a different place to somewhere that you may not have been, and might not even be able to go again for a while. And I know with COVID happening, there were definitely some switches to like the virtual lifestyle, which probably made it, I would say, even harder because now you were locked up in a room and people are trying to transition out of that too. So I would definitely say if you're going to like Ross or AUC, enjoy that beautiful space. Everyone doesn't get to experience that as much. And then for us being in Barbados, I really enjoyed the Bayesian culture a lot, and kind of being with the locals, going to Massey's, which is like one of the grocery stores they had there. And so in addition to what everyone else said, I would just say enjoy the environment as well, because it's kind of a once in a lifetime experience.
Thank you all so much for sharing that. I was gonna mention the beaches. I was like, ain't nobody talking about the beaches yet.
We don't have time to go.
Well, okay. Take your book with you. Does anybody take their books with them? No.
Yes, I did. Actually, I did do that one time. For me personally, I wouldn't recommend it because it was, I don't know, it's like distracting to like try and read and then you're outside on the beach. But that's my experience. Some people could do it. I personally could not. Yeah.
No,
Yeah,
definitely.
just to piggyback off of that, it seems good on paper, but no. If you're gonna go to the beach, then enjoy your time at the beach. This
Yeah, definitely. Like I remember sometimes I just used to deceive myself, like just do questions by the beach. Like I'm not doing any questions by the beach. Like I'm looking at the blue skies, like the clear waters. Yeah, and there's nothing better than going to the beach like after like you study really hard for an exam and you can relax, like it's a spectacular feeling.
That's a good idea, is to use the beach to de-stress, right? Because guys, remember, medical school is a marathon, not a sprint, right? Pace yourself. It's important to keep a balance, to keep your personal balance. Yes, you're gonna hit the books hard, but also no, don't burn out, right? It's 16 weeks of nonstop work. So find some time for yourselves. I have a question for the panel. May I? Okay. We have at least two panelists here who have taken the steps. So for those of you, how did you feel the school prepared you for the steps?
Um, if I'm being very candid, I feel like the curriculum, the medical school curriculum that we had, the examinations that we had at the end of the terms, I feel like the lectures it was like a lot of information, so much information, just tailored towards like Ross examinations. Now when you're studying for a step exam, you're dealing with vignettes, clinical vignettes, like that look a little bit different from like the Ross examinations. However, those Ross examinations, they really do good about like building your foundations, giving you the tools that you can use to like, think about concepts in like different forms. That's how I felt about it. It's definitely not enough to just like go to class and then like go ahead and take the step exam. No, like, and I'm sure that's the same for anybody. You still have to do like the same type of practice questions. Get used to like the system, and whatnot. But like even today, like when I do some questions, there's still some things that I remember like from my basic sciences, that like just help me, sway one way or another. Now I don't remember everything, that's something completely different, But honestly, like I really take pride in the education that I received. Even when I'm doing rotations as well, I feel good about like my baseline level of knowledge, and I'm able to stand side by side with peers that are trained, wherever they had the medical training, and still feel like I deserve to be in this position.
Yeah, I definitely agree. I would say for step one, I probably felt less prepared, to be honest. And that's just because, again, we kind of learned whilst in medical, like in basic sciences, how to study for Ross exams. But For step one, it was more so trying to study for NBME type style exams. And I think Ross has actually switched to taking NBME exams for the curriculum, just in general for their test now. So it's a little bit different, I'm sure. So for step one, I would say I felt a little less prepared because I had to adjust to learn how to take a different type of test. And then for step two, I would definitely say I was more prepared because now by this time I learned a little bit more, especially with the shelf exams, the clinical experience that I got rotating through different hospitals and just learning how to study. And I would say that's also something I would advise for basic sciences as well. Learn how, like, the best way to study for you. And once you figure that out, stick with it because there's no need to try and change it up. Just because someone's doing Anki and you're watching Boards and Beyond videos doesn't mean you need to add that to your the way you study just because someone else is doing it. So I definitely felt more prepared after I learned how to study a little bit better and just going through the material. I agree with like Ross creating that foundation in my basic sciences, but also I think it's beneficial for you to learn how to study for yourself and taking like step one, and then the clinical sciences portion, like step two, would definitely be a little bit easier once you again have that foundation and go through the actual like clinicals and stuff like that.
So, kind of in relation to that question, what support did you all receive in like in learning different studying strategies and learning styles and then applying that to your medical education and curriculum outside of the classroom? And whoever wants to start with this one.
I can start. Just so for me, I think regardless where you go to medical school, you have to be independent. They'll give you resources and everything that you need. So we had like Q banks to do questions. We have books that they provide us, and your um, professors or the doctors that are teaching will definitely help you, and you have study hours as well, in addition to like tutoring and study groups that you have, but it's still dependent on you. So they will provide you the resources, but you kind of have to figure it out on your own, to say the least, because you'll attend lectures, then you'll have to study the lectures by yourself. And it's not like you want to watch a 2-hour lecture and then rewatch it for 2 hours. So you kind of learn along the way how to study. And then again, like Brianna mentioned, kind of like study groups as well. You can join a study group and kind of see how someone else has learned something or maybe what you missed. So that will help you. But really, it's a little bit of a balance between you kind of figuring it out and them like giving you the resources as well. But that's just my take on it. I don't know how the other panelists feel.
So I really just did a mixture of everything because my first semester was just all about adapting and learning to this new material because the same things that I did in college I couldn't do in medical school. I mean, I could, but I wouldn't be a fifth semester. Um, so I go through the lectures ahead of time. So say they'll drop like 2 weeks of modules. I'll go and get those done in about like 2 days, and then I'll go to the Q&As, and that's my second time going over it. My third time going over the materials when I actually do my like group studies with my friends. And then if something is still not like sticking with me, I'll watch like maybe Boards and Beyond. But I typically use one specific question bank just to learn and see how that specific disease or that bug presents and like what the presentation looks like so I can get used to that. And then I'll use like a harder question bank like Amboss or UWorld for my test because if I can answer those, then I can answer the questions on my exam. But I typically go through the material about 4 times, just differently. And then I use Anki here and there. If something is really not sticking with me or a question I just keep missing, I'll just put it in my Anki and I'll just go over it and I'll like analyze it to see, okay, what's going on? Why is this not clicking? But yeah.
Yeah, I think Akuna and Brianna definitely hit on some major points. Being that like definitely like the one of the most important things is to know yourself, know what type of learner that you are. So like before I don't know if Ross still does this, but there was this thing that they did where they engage you like on social media, and then like they created this like daily task thing, and then we all had to fill out this quiz where we can find out what type of learner you are. Like, are you visual, tactile, audio and stuff like that. So that helped like moving forward, because I did realize I was more of a visual learner. So I had to just see things in different forms, and then eventually I think it took me to like my second semester to realize this, but one of the most important things is repetition, space repetition of information in different forms. You see a lecture, that's one form. You watch a Boys and Beyond, that's another form. You do practice questions, that's another form. You take notes, that's another form. You read the notes, that's another form. You listen to some audio, that's a different form. So the more you see this information in different forms, you just start to assimilate some certain patterns, and then you just get a knack for it. But it's only you that's gonna be able to tell what's best, that works like for your individual method, So I remember like I did like make like spreadsheets on Excel, like when we did have like lectures come out, I would like a number the lectures, and then I'll have like a box for Boys and Beyond or like Sketchy or any resource that I need to like use at that point in time, and then you know depending on my level of comfort with the lecture, then I'll put like a little note at the end of it, revisit it at the end of the week, and then if I fall behind, I fall behind, like it's not perfect, but I still do my best, to get back to that rhythm, and yeah, just take it at the end of time. And also realize that you're not perfect. There's definitely going to be those days where you just wake up and you're like, I just don't want to do this, and that's fine, that goes back to that idea of like having like a group of people, like a study group, those external resources that you reach out to, because I promise you, you're definitely not the only person that feels like that, and then just having that extra push, can definitely like go a long way in the long run.
Thank you so much. So we're coming very close to the end, but I do want each one of our panelists to give like maybe like a 30-40 second takeaway for our audience on why they should choose the and I keep saying international medical school.
As the sales representative on the call, I'll go first. I won't talk you into, like I said, for one of our schools, I am here to say we're an alternative, right? You should apply to all the schools that you can. Anything that is a good fit for you, you should apply. But know that we're here. We can be your backup. It's okay. We just want to make sure that you're not giving up on pursuing your dream to become a doctor. Good luck to everyone. Thank you for having me here. Make it work, whatever it takes, wherever you choose to go, make that path successful. Don't look back. Devote yourself 100% to reaching your goal to become a very good professional.
Does Brianna maybe want to go next?
Yeah, I'll just say, don't let statistics scare you. If this is what you want to do and you want to be a doctor, then pursue that. And just let your work speak your way. Let your work pave the way for you. But don't give up.
Chidebim.
Yeah, I was thinking of something profound to say, but like I can't really get to that point.
We got 30 seconds.
You got this. Like if you do believe this is the route for you, just go ahead for it and do it. But testaments, to the fact that you can achieve your dreams.
Okay, same thing with everyone else. Like, don't let anything stop you. If this is your dream, just pursue it. And don't forget that we have beaches. So, if that motivates you as well, come on through. But again, like, It's up to you. Choose what is best for you.
Thank you again to all of our panelists. We truly appreciate you all's time. We know that you all are busy, and as a pre-medical student myself, you know, I take in consideration all of the schools because, like you said, you know, I am trying to get, my end goal is to be a physician, and international schools is definitely a way to do so. So thank you to our audience, and we hope to see you at AMEC in April.